Welcome to the Practice Leader Podcast, brought to you by Ascent, a show for medical practice administrators who feel stuck in the daily chaos and want to lead with intention. I'm Zed Williamson, founder and CEO of Physician Growth Accelerator.
And I'm Paul Richards, president of Ascent and director of otolaryngology at the University of Utah School of Medicine. Every week, we explore what high-performing leaders are doing in real time, so you can stop reacting and start leading with purpose, strategy, and results.
Welcome to the Practice Leader Podcast. I'm your host, Zed Williamson, along with Paul Richards. We are here at the Ascent Conference in Kansas City, and I want you to think about maybe something from childhood, a seesaw. And on one side of that seesaw, you might be living in this world in business where you feel like you're working so dang hard and it's just not fun because of how busy you are. But on the other side of that seesaw is maybe a practice that feels like it's not busy enough. It's where they don't have enough patients. And that's why we're speaking with our guest today, James Benson with QM2 Solutions. James, thank you so much for joining us today.
Thank you, Zed, for having me. Happy to be here.
Excellent. So you have a unique perspective regarding this idea of the struggle of a ENT practice. Would you mind sharing a bit?
Yeah. Well, I think I have a unique perspective in that I've been in the ENT space for 25 years. And this is my 20th consecutive Ascent meeting. I like to say I'm a recovering practice administrator. I worked for several years with physicians running ENT practices in the state of Wisconsin and Michigan. And I started this company, QM2 Solutions, out of the fact that I felt like we weren't doing a good enough job focusing on our most important resource, and that was our relationship with patients. And I thought if we could do a better job of focusing on patients, everything gets better. The quality the patients receive from their care is improved. The reimbursement and the revenue opportunities are more realized, and ultimately everyone starts enjoying their job more. Changes the culture of organization because you're focusing on why you got into healthcare, and that was making a difference in patients' lives. And so the problem that seesaw you just talked about is really what is manifested in our sort of drift from the importance of patients, what they mean to us as a business, and what it means to us as clinicians and professionals who are working to serve those really important people that what we're in the business for.
It's so important what you're saying, and I'll shed a little light on something that we do. Is sometimes we will go into a practice with the entire team, and I know how far we have to bring that practice depending on how they answer the question, can you tell me some recent patient stories? And I want the stories to be about the patient's life, not about that you just helped them. And if a practice can't share those, that practice is in a different position. They are on one of those two ends of the seesaw, compared to someone who knows the human stories behind what they do, because that's why you do the work. And if you don't have those, then you will be miserable.
Well, I think, one of the things that our business does was really two sides of our business. There's a patient experience and reputation management side, and then we have our clinical monitoring side of our business. And one of the things that we find with patients, the decrease in patient experience scores or reputation are the fact that people become transactional in a practice, right? The front desk has been instructed and told about all the information they need to gather. The billing is totally focused on the coding and billing aspect. The physicians are working on those transactions, and what you lose are those patient stories. When I was an administrator, I think one of the most valuable things that we started doing is once a month, we would have a patient story in our break room, and we would talk. And remember that we're ENT practices, and we get, focused in the day-to-day of a lot of the things we do, maybe tonsils and tubes, or we're doing sinus cases, we're doing things. But there's really important life stories that are being affected by what we do in those offices every day, and really important life and death decisions that our clinicians and physicians are making. Keeping those in front of us, and then how that affects the daily lives of patients is again, it's the whole thing. It's the whole thing. And if you're focused on those things, on managing and monitoring the patient experience and their symptoms and functions over time, man, you make a huge difference in their daily lives. And ultimately you'll feel really good about what you do as a medical practice.
When you first talk to a practice, and let's say they reach out to you because they feel like they're having some challenges.
Yeah.
Do you tend to find that they are speaking to you about the challenges that are real, or are they more on the surface level, symptom level of challenges, and you have to help them understand that there's a different root cause that has them there?
That's a really good question. I think when everything is amplified, nothing comes through. And I think most medical practices are they're chasing one thing after the other. So I think they have a real hard time of sort of they don't have some sort of large strategic goal. They're just managing all these things. And so I think they never take a chance to take a breath. And why maybe this meeting is so important to so many of these people is gives them a little bit of distance to say, these are the big issues that we have. And if we could just focus on those, even just for a few days, it makes a big difference. So very directly to your question is they rarely know what the problem is or what a problem is. They're focused on, 10 things.
Yeah.
Yeah.
What do you find they are the most surprised by when you start working with them?
Well, something that's been very clear recently is one of the services we provide is we engage patients who have fallen off of treatment. They might have been diagnosed with a problem, scheduled for a surgery, but never had the surgery done, or have hearing loss and never came back in for evaluation of a hearing aid, for example. After we start monitoring these chronic or allergy patients, for example, who stopped having treatment for whatever reason, when we start re-engaging those patients, the number of patients who come forward again saying, well, I was waiting for the physician to call me with result, or I was, you came and I had a hearing evaluation and I didn't hear from you, so I went to Costco, or whatever those things. And the volume of people who actually go on to receive treatment or care someplace else just because the practice completely forgot or didn't respond. And by the way, that's not a sometime thing. That's at most practices. They don't have any systems to be able to follow up and re-engage patients. You know that from your own experience. How often do you get a call a week, 2 weeks later from someone in an office to say, hey, I'm wondering how you're doing. We're following up on getting this test scheduled or whatever. It just doesn't happen.
Are you talking virtual, phone, text? What kind of messaging are you talking about here?
So in our business, we monitor patients, we initiate contact, or we essentially prompt them with texts or emails. The activity that we happens all behind a HIPAA secure, all the real communications happen between a HIPAA secure portal that they do. Nice thing about our application is they don't have to log in or remember any of those things. It's a single click connection. But essentially what we do is maybe different. It's not some transactional thing that someone has to trigger. Is we've identified sort of over the life cycle or lifespan of a patient, sort of what the care pathways are and what are the key times to re-engage patients on their care journey. So if we're able to prompt them at those times, they're much more likely to then re-engage and act on care versus some sort of mass follow-up to some list you produce and we're going to essentially sell them something. And I think what the difference is that what a lot of people do is they're trying to sell patients on service. And it's not about marketing to patients. It's really about managing patients where they're at, identifying they have a medically significant issue, identifying the ramifications and costs, acknowledging the deficits the patients are having, saying, tell us what's wrong with you. They will tell you. And then you can say, I can help. And it's that I can help, that outward, that reaching towards the patient for that handout is what makes all the difference. That makes all the difference.
Do you ever get pushback from the practice saying, I don't want to seem too aggressive in reaching back out to these patients?
Yes, we do. I think there's a hesitancy to going forward with, like, you don't want to seem too aggressive or pushy. But our approach is, and again, we really talk about this isn't marketing.
Right.
This is an enhanced service. If you were to look at the number one reasons or the things that people have problems with healthcare, everyone says, well, there's a problem with healthcare, and we all have a different thing. But the number one thing is access. Patients want more access with their clinicians. Why are we seeing such a huge growth of companies like BetterHelp, for example, for mental health, or HIMSS for men's health issues? There's a huge number of, in the physical therapy, ortho space, there's some gigantic players coming forward because patients want access when they want access. And if we're only operating in a 9 to 5 office environment, you are losing patients to those folks. I often say to sinus practices, your biggest competition isn't some other sinus surgeon down the street. In fact, we'll have a practice say, well, we're the only game in town. There's no sinus doctors within 40 miles from us.
Yep.
I'll say your competition isn't some other sinus doctors. It's Walgreens or it's the CVS or some urgent care down that is continually mismanaging chronic sinus disease for years over years. And those are the patients you're missing because you're not engaging patients when they need you.
And, from the neuroscience side of things, if you wanted to prove to a patient that you don't care about them, don't follow up. That's a perfect way to prove that you don't care.
Yeah.
If you want them to know that you care, you follow up. And it's not going to be aggressive. It's proof. And that's where that's why I asked that question, because they think it's the other thing. Oh gosh, well, we can't reach out. I mean, if they want to do it, they're going to move, they're going to call us back. No, it's like if someone gave you, some advice on something that in the moment you thought they felt it was really important and then never brought it up again, you would go, well, I guess it didn't really matter.
That's really important. Yeah.
Yeah, we see this in the audiology space because a lot of we work with a number of companies and they're great. It's not that marketing is wrong, and there's some times when marketing matters, right? There's a new service, there's a sort of a new benefit, and those are things that will drive activity. So we don't say that they're wrong. You have to do that too sometimes, right? But the sort of concept around moving from marketing to management means asking a patient what's most important to them and then let them tell you those things. And the listening and saying we care and when you're ready, we're able to do something is a huge, huge thing. In the hearing aid industry, though, there's a list of objections. It could be cost. It could be a spouse acceptance. It's sort of these things. And they say to the team, like, this is how you get over the cost objective. And I'm like, when you talk to a patient about how hearing loss is affecting their life and that, and what would they like to see different happening in their life, and you can provide them like that you care about that thing and that you want to join them on that journey to fix that thing, cost and those other objectives disappear. Yep. It's about solving a problem. And so I think we need to take that approach much more often than we do just trying to eliminate the surface objectives that patients put forward as a way of avoiding maybe the core issue, right? Of why they're not going forward with treatment.
Yeah, it's really important. James, I really appreciate you joining us today on the podcast. I hope you have a great rest of the conference. If someone's listening to this and they want to learn more information, what should they do?
Well, the easiest thing is to go to our website, which is QM2Solutions.com. Or they can there's a phone number available there too if they want to reach a hold of us. So
Great.
Very easy to get a hold of us.
Okay. And we'll put a link to that in the show notes so it's easy for people to access. And thanks again for joining us.
Fantastic, Zed. Thank you.
Thank you.
Paul, thank you. Have a great rest of your meeting yourself.
Thank you. And we'll see you next week on the Practice Leader Podcast.
Thanks for listening to the Practice Leader Podcast. If you're feeling the weight of challenges in your practice, know this. The problems you're struggling with today don't have to remain problems. There is a path forward, and you're not walking it alone.
Each week, we'll be here with insights, ideas, and real-world conversations to help you move forward from chaos to clarity.
See you next week.